Thank you, Carrie. I'm really excited that we're looking at AI from the perspective of the patient, and all the more that we're joined now by four industry leaders from diverse organizational backgrounds for a discussion of AI and the patient experience. Let me introduce Nancy Colton, Staff Vice President of Digital Platforms and AI Office at Elevance Health. Dr. Moleen Madziva Taitt, Vice President of Global Clinical Affairs at VizAI. Dr. Jared Pello, Chief Medical Officer at Microsoft and co-founder of Bionic Health. And Rajiv Ronanki, Chief Executive Officer at Lyric. Welcome, all of you. Thanks again for joining us. We have a lot to discuss. So let's begin with this question. How do you think of the role of the patient in AI in your own companies as you're involved in all these important deployments? So Nancy, why don't we start with you?
At Elevance Health, we put the patient in the center of everything that we do. And as we embark on this kind of AI journey, that doesn't change that mission. We continue to drive better member experiences, as well as help our providers, as well as our internal associates. But the patient is always at the center of what we're doing.
Dr. Taitt.
Yes. Hi, thank you. So at VizAI, one of our core values is patients first. And we really live by how we work every single day, by thinking around how we develop our digital health tools and AI algorithms, really thinking around, the patient population data that we use, ensuring that there's diversity in that data set, but also in all of the clinical research that we do around the impact to patients, whether it is how their care is coordinated or how they actually will end up with outcomes that are impacted by the digital health tools that we put out. A lot of times we are constantly thinking around how do we include patients in everything that we do so that we can develop products that are actually sustainable for patients.
Jared, what's your take on this?
Well, it's interesting. If I take the frame of Microsoft, I can speak so broadly just because Satya speaks broadly about the mission to enable everyone everywhere for better health flourishing. But I'll take a very specific kind of example. Like we have a platform people can build on, but we also have first-party applications. And one of my favorites is Dragon Ambient Experience because I think of it as what it does is record doctor-patient conversations and then uses AI to write notes for doctors, which you might say, okay, what's in it for the patient? Well, what's in it is so many things. Doctors who aren't experiencing burnout are 30% less likely to commit an error. So those experiencing burnout commit errors. Those not are less likely. The other is 90% of patients who see a doctor using DAX say that they're focused on them, which I think we all want that when we go to the doctor. We want the doctor actually focusing on us and not the computer. So that's kind of my quick take on how I think about AI for the patient.
Raj.
Yeah, thank you, Zach. And I'll build on what Jared said, right? So our view at Lyric is that every one of us at some point down the road is going to have an AI assistant. That's an expert at doing various things. There is a dream that someday it'll do some household chores. But in advance of that, I think it's got several other roles to play, including potentially becoming a medical assistant that deciphers all of the complex decisions that we need to make, all the care that's already been rendered, and explaining that in an easy to understand manner for our patients. And then ultimately providing a roadmap for what the care journey ahead might look like. And so imagine, last year I had done a TED Talk and I titled it "The Prompt Is You." With all this talk about prompt engineering, imagine if we could take our medical records, our claims data, our benefits, our genomic data or phenotypic data, and train sort of a secure private LLM on you, And then it prompts all of the things that you have to consider. Of course, we're several years away from us being able to do that safely and efficiently. But I think this is where all of this is headed, and I, for one, am very excited about what together we can do as an industry to facilitate this.
So, Nancy, I'm going to ask you, I think, a slightly provocative question, which is, I think in many ways, the big analytic companies like Elevance, which have a lot of healthcare data, and in the end are helping us make decisions about what's important and what should be done, have a front and center role in how patients experience healthcare, how they know what they're entitled to. And I just wonder if you could just hum a few bars about how either now or in the near future you see Elevance taking on that role and using AI to help patients navigate what their options are, what possible benefits. I can tell you as a patient, I have trouble understanding my healthcare policy. And so it seems to me there's lots of areas that Elevance is probably already involved in. If you could just pick one or two, that'd be great.
For Zach, and that's actually a great example of the things that our patients experience and members experience as they embark on a care journey. A couple of things that we're doing at Elevance is helping people understand what their benefits are. I mean, as an example, when somebody calls our call center or logs into our digital portals, they have a specific question, and maybe that question is about a benefit and is it covered? And because of the vast amount of information and a variety of different benefit documents, it can be fairly overwhelming. So we're looking at areas where we provide our customer service representatives that kind of AI assistant, so that they can get to the crux of the information as quickly as possible to really help our members understand what is covered, where do we need to, where can we focus, how much might it cost if you go down that path. And then even as you start to have questions after the fact about, well, why wasn't my claim paid? Things of that nature, we're putting that information and those kind of digital assistants in the hands of the folks that do the interactions with our members. So it's never about, it's making that information more available to better assist our members.
I think I heard you say something important, which is probably the right thing, but it's an expensive decision, which is you're keeping humans in the loop, which is you're not sending patients to the AI equivalent of a phone tree.
Yes, and that's an absolutely key point. We are doing everything around having that human-centered assistance, as well as making sure that we're doing it in a responsible way. So even though we're providing that information, to, as an example, a call center assistant, we're still ensuring that it's the right information and it's been through a rigor of our, responsible AI components to make sure we're getting that the best, care and information to those members.
So, Jared, I'm old enough to remember all the Seinfeld episodes, and there was one in which a lot of shade was cast on one of the characters was trying to see their health record. And I'm wondering, now that you're with some of your products at the crux of the health record, have you begun to see the use of AI to give patients not only access to, but a understandable version of what the heck the doctor actually said, what the heck the plan was, and how they can perhaps answer questions before the next visit to the doctor?
I think we're at the beginning of that. We're already at a very exciting point. Built into our product, we have the ability for the doctor to ask for a very simple, eighth, ninth grade reading level explanation of the patient's visit to give to the patient when they leave, which is a great first step. I think with the things we know that are happening with like TEFCA and the ability for patients to ask for their own medical records, I get even more excited about, what the future might look like, having intelligent AI helping a patient understand where they're at. But yeah, I think we're already at such an exciting point where, with all, even physicians, like if I go to a specialist, I sometimes need an interpreter at the end. And I think as physicians, it's easy for us to forget how much of a different language we speak and how useful it is to have that interpreter just there for a patient.
Yeah, it reminds me, I was told when I was in medical school, and I think it's said to intimidate me that I was going to learn 20,000 new words, none of which I use. Anyway, Molly, your company is involved in really helping doctors involved in some scary moments where, for example, you're evaluating cerebrovascular accidents, strokes. Where does the patient fit into all of this?
Yeah, that's such a phenomenal question. So the work that we are doing at VIS is really thinking around how do we speed up access to life-saving treatments. When our AI tools are being utilized, whether it is for stroke or in cardiology or in oncology areas, we are constantly thinking around how do physicians make decisions in such an efficient manner that then impacts the patient. We recognize that, let's say a patient has had a stroke and they actually need to be referred to cardiology afterwards. Having a tool that can coordinate that care and ensure that the system is actually augmented for support will impact patients, not only perhaps their length of stay or other areas of impact, but sometimes that may also even impact the economics of how they are actually accessing the care. You may also think around disease states that may be considered rare or not as acute. We work at the moment in hypertrophic cardiomyopathy. That's another condition where it might take longer for a patient to actually get diagnosed. And our AI tools are supporting, ensuring that patients are put on a care pathway that supports getting the therapy that they need.
That's interesting because I think when we were talking to perhaps your CMO or CEO, he didn't tell us about the care coordination part of it. So news to me. Thank you. All right. So Raj, what do you think of all this from the perspective of Lyric? Where does the patient fit in?
Yeah, Zach, thank you. The patient's always going to be front and center to everything that we're doing. And the way in that Lyric in our small sort of platform make that happen is by understanding all of the innovation that's happening in the clinical, medical, therapeutic space, and then figure out what of that should get reimbursed and how so, and what's medically necessary, and enable health plans to make that determination. And in so doing, what we're really sort of getting at is like, how do we make all of the innovation that's happening and all of the care that's already out there effective and affordable so that it can reach as many people as it should, while questioning and examining the things that are more on the leading edge of things that perhaps for which there's more evidence necessary before it qualifies as being applicable to the general population, as well as, the therapies that may be only applicable to a small percentage of the population, figuring out how to get that reimbursed. All of those things are important issues, but, oftentimes we lament the U.S. healthcare, system. But the good news is that on the care delivery side, there's a tremendous amount of innovation that's happening, and that'll continue to happen. The question is, what role or how do we make that affordable to everyone and make it accessible? That's the role that Lyric occupies in the ecosystem.
That's very well put. And as someone who's involved both with rare disease patients and with patients with common diseases, I'll ask a tough question for Nancy. This is not a gotcha question. It's a question that all of us in society have to deal with. how do you think about how we measure, especially now that AI may automate that process, priorities in how we essentially enable different policies? Someone with a common disease that is having a heart attack, they deserve good care. On the other hand, someone who has a very rare disease that's going to cost a lot of money. On one hand, they deserve good care, but how many other people in a poor neighborhood could you give great care for that price? So I know we all like to think of this as being not zero sum. And one of my late colleagues, Paul Farmer, when he used to go out to Haiti, he would argue with me, like, we should not be thinking that way. We should do everything we can. But in the end, someone is there with a fixed resource, at least for that year. So Nancy, how do you think AI is going to play into that, into helping us think about values?
Well, certainly, in the role and for Elevance may be slightly different from that perspective, but we obviously want to continue to provide support for all of those patients and those members, regardless of the need. However, the area that it can kind of play in is leveraging AI to look at all of those opportunities and ensure that those folks are getting the right care. And hopefully it really is not intended to prioritize one over the other. There is really no reason that we cannot do all of those and make sure that we're doing it in the best way possible to connect those members in their care journey to the right providers who can produce the best outcomes.
Okay. Zach, if I might add something to that, all right? So you kind of alluded to this earlier, which is humans need to be in the loop. And I think that's generally true, but I think where humans need to be in the loop is very appropriate to this question, which is, I think that clinical expertise, humans should absolutely be involved in all care decisions when it comes to humans and patients. Now, the question is, do humans need to be involved in answering phone calls? Do humans need to be involved in generating claims, managing rev cycle issues, billing, all the things that comprise of the surrounding elements of care? And arguably, all of those are great candidates for automation. And in so doing, I think we can free up the precious resources and allocate them towards care. And, we all know this number that floats around in our system of $500 billion to $1 trillion of waste. So that's where it's all going, which is that humans are involved in all elements of healthcare, whereas they should be in a very critical subset, and the rest should be handled by tech. And so as we work towards that future, I think this becomes a trade-off between waste and care versus determining where care should be applied.
Yeah, and I can add a little bit more to that as well. Sorry, Zach, I see you're about to chime in. So you asked me a question around priorities in access to care. I can take a little bit more time to focus on the access to care, because then that, in many ways, that will impact priorities and how they're actually laid out in the healthcare system. So at Viz.ai, one of the reasons why we decide to take a particular imaging modality and focus our AI based on that is because we're thinking around which one is actually the easiest to access. So when you think about certain cardiac conditions, you know that most patients, when they arrive with a cardiac condition, they might actually get an echocardiogram. So we will then focus our AI based on that. It already allows us to have more access, provide more access to patients just from that imaging modality alone. And then, of course, we augment that and have integration to the EHR system so that we can pull as much data that was already existing so that patients don't necessarily have to get more imaging that's required or more testing that's required because it's already in the system. So from an access to care perspective, I think those priorities can also be taken care of if companies are taking a little bit more of an informed approach around what are healthcare systems burdened with and how can they support so that it impacts patients really down the line.
So, Jared, you might want to dodge this question and say it's not your problem. But what Molly just said reminds me of the following, which is in order for a company like Viz.ai to actually do what they do, they have to have, as Molly just said, integration with the EHR. Now, on the patient point of view, through the 21st Century Cures Act, patients now are legally entitled to sort of API-driven access to their data. Do you see equivalent data flow enablements or blockages for different companies to have access to that data to serve patients?
There's been some really good movement in this space, Zach. Epic has started their whole Epic on Fire or Open Epic, which if people don't know about it, what's interesting is it puts the ball in the court of the health system, meaning that Epic has opened up these APIs and said, here are all the data sources you can pull and push from, and you don't have to come ask for permission anymore. You can just do this. And you can bring a vendor, you can bring whoever it is that needs to pull and push data into Epic and do this. And that's a really good step in the right direction to make it more valuable for patients. And then maybe I'll just jump on the bandwagon of abundance that Raj kind of painted. Raj painted this area of, as we have more AI that does more for us that humans have had to do in the past, it should free up resources. And this is even on the physician side. If I don't have to do administrative tasks all day, then I can take care of more patients. And I think that is the optimistic view of AI. There's the pessimistic view that it's going to drive up costs, but there's the optimistic view that actually we automate so much away that we can provide more care to more people at a higher quality.
Yeah. And I'll just jump in as well, if I may, Zach. I love what Jared is talking about and addressing here, because sometimes patients may feel that their data is ending up in the places where it shouldn't be. But think around the amount of time perhaps that a clinician has to spend looking through a lot of records for their chart to then find information that supports the care coordination. So if AI can actually support reducing the burden on the clinician side, it actually allows for the patient to then get better outcomes, because then they're getting into their relevant care pathway in a much more efficient manner.
So this brings me to my next question. We have 5 minutes left, so let's try to pack it in. And just to keep us all awake, I'll be, as always, a little controversial. Given the fact that there's broad recognition that we're not making enough primary care doctors, and that primary care doctor-driven healthcare is increasingly challenging, what do we see in terms of the use of AI to help other healthcare professionals, such as nurse practitioners or PAs, physician assistants, help us meet this growing need for primary care? Raj, what do you think?
Yeah, Zach, I think it may be an and thing versus an or, meaning that, yes, we need to create better tools for physician assistants, physician extenders, nurses, and enable a broad team of clinicians to be a part of the primary care value chain. But I think there's also an equally important innovation that needs to happen, which is how do we reimagine the role of primary care? When we were growing up, I think the primary care physician had a longitudinal relationship where the physicians knew what was happening in our life and was a guide, to care and care options and better health ultimately. And over time, for various reasons, it's become a very sort of a 15-minute cursory visit that, neither party gets much benefit from. The physicians are burnt out by it. The financials don't support investing that much time in practicing primary care, and then the patients don't get much out of it. So it's sort of seen as a cursory step. But what if we could actually restore that original relationship between the primary care physician and the patient to where lifestyle, diet, exercise, choices, stress, everything else, all the factors that contribute to health. Now someone's quarterbacking all of that. And where they need specialized care, of course, you tap into that. But I think we need to reimagine incentives. I think we need to reimagine tooling. I think we need to imagine how physicians with AI can practice better primary care. I think all the pieces are there, but I don't think we've put together a business model that makes that work sustainably. But I'm optimistic that we can make that work.
So, Molly, in the areas that you're describing, there's actually a range of healthcare professionals. How do you see AI allowing us to spread to a broader set of healthcare professionals?
Yeah, that's such a great question. So the way that we envision this, and we've actually gotten some real-world evidence that even proves that there is a promise for AI in the area of supporting, clinicians from all levels of expertise, where you might need to suggest, do I transfer a patient from a community center to an expert center, or you are deciding on do I actually need to place this particular patient on this care pathway. So depending on your expertise, AI can actually be truly an augmentation to a lot of the work that's happening. And it's really more about that care coordination and ensuring that patients will get access to those life-saving treatments. We partner a lot with life science partners who are really keen on seeing that they support for healthcare systems that may or may not have a lot of the experts that are required in the clinical workflow every single day. But when you have AI tools that are actually utilizing the imaging and other EHR data for the patient to support the care coordination decision making according to the guidelines for those treatments, we really do see a promise for AI in this space.
So I'll give Jared the last word. So as a practicing physician, how do you see AI spreading or not the relationship between the patient and the healthcare team?
Yeah, I think there's several ways. Upskilling our current staff, whether that's physician, I need to be upskilled too. We know that Institute of Medicine years ago told us all the errors we make. And so I want to be upskilled. I want to be smarter. If the AI can look at the patient context and maybe the sensitivity for urinary tract infection in my local area and tell me which antibiotic I should be prescribing, I want to see that. And so it's a matter of capturing the right data, bringing it to bear, putting it with the right sources. That could be hyperlocal, like my microbiology lab sensitivities, or it could be more generalized, like the American Heart Association or something like that. But I think it'll happen at the doctor level, at the physician extender level, at the nurse level, at the MA level. I think everybody will be upskilled by AI, by the idea of having kind of your own personalized co-pilot kind of helping you.
I really like that answer, Jared. Thank you. Well, our time is up. This is great. I really want to thank you all for your thoughtfulness and transparency. I want to thank you for your participation. I definitely enjoyed the conversation. I hope you did, and I hope our audience did as well. Now it is my pleasure to introduce Dr. Xiao Liu, Associate Professor in AI and Digital Healthcare at the University of Birmingham and University Hospitals Birmingham NHS Foundation Trust. She is also a colleague and deputy editor at NEJM AI.